Hi, my name is Charles O. I am a Senior Director of Clinical Development at Janssen Scientific Affairs, and today it's my pleasure to introduce this poster that we did on a study for the efficacy and tolerability of tapentadol immediate release versus oxycodone immediate release in patients with moderate to severe acute low back pain with associated radicular leg pain. So basically what we did was a head-to-head study between tapentadol and oxycodone in patients with acute back pain with some radicular symptoms going into the leg. And this was a head-to-head study looking at a 10-day duration of treatment. The doses that we used were tapentadol 50, 75, and 100 milligrams versus oxycodone 5, 10, and 15 milligrams given every 4 to 6 hours as needed for pain. The patients were allowed to titrate up or down on dose or duration to accommodate their level of pain relief and also to accommodate any tolerability. So what I'd like to point out is first the study design, which is that it was a randomized head-to-head study with the two groups. There were approximately 500 patients in the whole study, about 250 in each arm. And then we looked at the primary endpoint, which was what's called SPID, which is the sum of pain intensity difference. And the primary endpoint was at day 5. So if I could just point to the results now. Here we have for the low back pain and also for the leg pain, the comparisons of SPID at various time points of 5, 2-day, 3-day, 10 days, and you see the same here. And the primary endpoint analysis was based on a non-inferiority comparison. So as you can see from just visually the graph, tapentadol was non-inferior to oxycodone IR in the doses that we looked at in this pain model. And so that's the efficacy portion where we showed non-inferiority. Now if we could just point to the tolerability aspects. So what's most notable is the gastrointestinal adverse events that were experienced in the study. And as you can see, overall there was 29.3% gastrointestinal adverse events in tapentadol versus 43.2% in oxycodone. And you can see the breakdown for vomiting, nausea, and constipation. And when you look at odds ratios, both vomiting and constipation were significantly more likely to occur in the oxycodone group, as you can see here, than they were for the tapentadol group. So in summary, this was a head-to-head comparison in acute low back pain of tapentadol IR versus oxycodone IR, in which we showed non-inferior efficacy with favorable tolerability, particularly in the GI adverse events. Thank you.